After studying this module, you would be able to learn about the key concepts of the psychoanalytic approach to counseling, understand the counseling process involved, examine the counseling techniques and procedures of the psychoanalytic paradigm, and evaluate the contributions, limitations, and criticisms of the psychoanalytic paradigm. Introduction. Post-Freudian psychoanalytic theory, object relations theory, focused attention not on the pleasure-seeking motivation but on the object-seeking nature of motivation. It was a new method of therapeutic work, infant and child observation, that added momentum to this shift in emphasis from an internal drive based on instinct to seeking an object or person. Those contributing to this shift and expansion of knowledge and theory included Melanie Klein, Donald Winnicott, and Heinz Kohut. Kohut, 1977, developed a theory and technique that came to be known as self-psychology, which emphasized the concept of self as the organizing construct of experience rather than innate drives and instincts. These post-Freudian theorists taken together can be seen as expanding psychoanalytic theory from Freud's one-person system to a two-person system, attempting to negotiate a balance between inner needs striving for gratification on the one hand and the constraints of society or the reality principle on the other hand. The scope widened to include another person, that is the analyst. Freud's metaphor for psychoanalytic treatment was the surgeon removing a tumor or repressed memory. In addition, Freud conceived the analyst as a mirror, non-reactive, non-contributory, reflecting back only those unconscious desires and fears emanating from the client. Winnicott, 1958, who was a pediatrician before becoming a psychoanalyst, considered therapy more like the relationship between a mother and an infant, where there is a highly attuned emotional sensitivity, first on the mother's part and then as the infant develops, of a more reciprocal nature. These object relations theorists did not discard Freud's theory but tended to add to it the significance of interaction with important others in the formation of personality and pathology. Rabin, in the year 1995, described a paradigm shift in psychoanalysis that can be characterized by a number of different terms such as intersubjectivity theory, relational theorizing, and social constructivism. This paradigm shift is away from Freud's metaphor of analyst as archaeologist sifting through strange symbols, example dreams, slips of the tongue, etc., to decipher meanings and present them to the client with an interpretation. This shift has also entailed a greater awareness of and use of the therapist's or counselor's feelings and thoughts during a therapy or counseling session, data referred to as countertransference. Freud viewed such reactions as contaminating therapy and saw them as a function of unrecognized neurotic conflicts within the analyst. However, recent trends are towards the recognition and use of countertransference as a tool to facilitate therapy or counseling. Goals of psychoanalytic counseling. The overall goal of psychoanalysis is the best possible psychological equilibrium for the functioning of the ego. Specific treatment objectives include improving the ego's conscious and mature control over irrational and harmful impulses and instincts, enriching the nature and variety of the ego defense mechanisms so that they are more effective, mature, and adaptable, encouraging development of perspectives that are grounded in an accurate and clear assessment of reality and that promote adjustment, developing a capacity for healthy and rewarding intimate relationships along with the ability to express oneself in rewarding ways, and reducing the perfectionism, rigidity, and punitiveness of the superego. Freud's writings offer a rich array of approaches to achieving these goals. Intervention strategies. The intervention strategies that are part of the psychoanalytic theory place special emphasis on free association, dream analysis, analysis of transference, analysis of resistance, interpretation, and the interactions that take place between the client and counselor or therapist. Extensive supervision and training are required to master the rich array of intervention strategies associated with classical psychoanalysis. Now let us throw some light on transference and countertransference. In transference, the client projects onto the therapist characteristics of another person, usually a parent, and reaches to the therapist as though he or she really does possess those characteristics. Transference involves a distortion or misperception of the therapist and is not a direct response to the way the therapist actually is. The unobserved and neutral psychoanalyst is more likely to elicit transference reactions than is a therapist who engages in self-disclosure and interacts more actively with clients. Transference can be positive, negative, or mixed. For example, a client may project onto the therapist the seductive but loving traits of his mother. This is an example of mixed transference. The angry and rejecting attitude of his father. This is an example of negative transference. Or the warm and nurturing characteristics of his grandmother. This is an example of positive transference. Freud saw the establishment of transference as a key component of successful treatment. Some degree of emotional health and a capacity to form relationships is necessary for people to establish a transference. That is one reason why Freud's approach works best for people with neurotic, example, depressive anxiety disorders, who maintain contact with reality rather than psychotic disorders. 3 stages are involved in the lengthy process of working through a transference. Once the transference develops, it is further established and explored in order to elicit repressed material. Gradually, the original dysfunctional pattern re-emerges, now in terms of the transference to the therapist. Finally, the origins of the transference are understood and resolved, strengthening the ego and freeing the client to relate to others in healthy ways. Although countertransference was not a salient part of Freud's work, many therapists today from both psychoanalytic and other theoretical orientations pay attention to it. In countertransference, a counselor projects onto a client characteristics of important people in the counselor's past. A therapist with a mother who exhibited passive-aggressive behavior might berate a client who was delayed by a traffic jam, projecting feelings towards the mother onto the client. Counselors should not assume that they are too skilled or insightful to develop counter-transference reactions, but should carefully monitor any strong emotional reactions they have towards the clients for the possibility of counter-transference. The importance of counselors having awareness of their reactions is one of the primary reasons personal analysis is a required part of training in psychoanalysis. Now let us talk about dreams and other reflections of the unconscious. Freud believed that dreams, symptoms and errors all reflect the unconscious and its fantasies. His writings, Psychopathology of Everyday Life in the year 1938 and The Interpretation of Dreams, also in the year 1938, discuss in depth the process by which the unconscious is revealed. Freud believed that all dreams are meaningful and that dream analysis may be the most important way to understand people. He viewed dreams as fulfilling wishes or impulses that could not be allowed into awareness, providing a vehicle for working through disturbing thoughts and feelings. Although people may recall the manifest content of dreams, the defenses of the ego displace and condense the underlying significance of a dream so that it is disguised. Unconscious events and emotions may be repressed in dreams by items or experiences that seem unimportant but may nevertheless cause anxiety because of their latent meaning. For Freud, errors, omissions, slips and poorly performed tasks also had latent meaning, and the term Freudian slip has come to mean a misstatement that reveals an unconscious wish or feeling. For example, a man who was attracted to his next door neighbor, a woman called Lou, left her a note that a package that had been delivered to him by mistake. However, he addressed the note to Dear Love rather than Dear Lou. Now let us talk about another intervention strategy known as free association. Freud used many approaches to access repressed material, including analysis of dreams and transference as well as free association. The process of free association reflects the most important rule of psychoanalysis. That is, people should say whatever comes into their minds without censoring or judging. Free association is the automatic linking of one thought to another which we all experience. We may hear a song that reminds us of the dance we attended when we first heard it, reminding us of our date for the dance, reminding us of the rage a parent expressed when we returned home after curfew, reminding us of the beatings we received from that parent, reminding us of our repressed impulse to attack the parent. A song, then through a chain of association, can bring up strong feelings of anxiety because of its link to emotions that we have been able to accept and process successfully. Freud encouraged free association in his patients to facilitate their recall of past material and release intense feelings. Blocks in the chain of association are another source of information about repressed material. Yet another intervention strategy is abreaction. Although Freud placed primary emphasis on uncovering repressed material, he also recognized the importance of emotions. He believed that affect needs to accompany the recall of past material in order for people to successfully understand and work through the importance that material has for them. To facilitate this link between emotions and the recall of repressed information, Freud often encouraged abreaction in his clients. Abreaction entails recalling a painful experience that had been repressed, working through that painful experience and the conflicts it created by reliving in memory the experience and its associated emotions, analyzing that experience and achieving an emotional release as the culmination of that process. This technique is used today not only in psychoanalytic treatment but also in other treatment approaches that people cope with strong emotional reactions to past events. Finally, let us talk about interpretation and analysis. The most fundamental techniques in Freudian psychotherapy are analysis and interpretation designed to promote awareness and insight. Whether his focus was on dreams, slips, transference, free association, or symptoms, the tools of analysis and interpretation enabled Freud to bring unconscious material into consciousness. Once this had occurred, people could gain insight into and work through previously repressed material and make connections between that material and their present difficulties, resulting in positive change. Analysis is the process of thoroughly exploring and understanding the unconscious representations in the material people present in treatment. For example, in analyzing a dream, Freud would explore with the client the meaning of each item in the dream. The person would be encouraged to free associate to the dream, to talk about both the emotions reflected in the dream and those experienced upon awakening and recalling the dream, and to discuss events in the recent past that might have triggered the dream. Emphasis would be on the wish fulfillment represented by the dream and on suggestions of repressed, unacceptable sexual or other urges. Interpretation is the process of elucidating the unconscious meaning of the symbols in material that clients present and of linking those new insights to their present concerns and blocks. Cognitively and emotionally, working through material previously housed in the unconscious enables people to understand the influence the past had on them and to use the mature defenses and strategies of the ego to make choices that are wiser and freer of the negative impact of unconscious material. Other analytic procedures include confrontation, clarification, and working through. The procedure of working through is of great significance because it involves the continued analysis of resistances brought about after an insight has been achieved. It refers to the broadening and deepening of insight that leads to permanent change. An example of a resistance would be a client who takes great pains in coming to sessions exactly on time, not a minute before or after. This behavior would be thought of as a resistance to whatever experience the client might fear in being late or early. Being late could represent aggression towards the counselor, that is, making him or her wait. And being early could mean a feeling of need of the counselor and fear the counselor will be disapproving. Working through in this case would involve confronting the client with this behavior and helping him or her sort through feelings, thoughts, and fears about the behavior. As such, resistance often continues for some time. The process of working through takes several weeks or months to reach the point where the client does not act or frees oneself from acting in this case. The client works to put his or her feelings into words and perhaps fantasies, images, or daydreams, and arriving at an understanding that would obviate the necessity of the particular resistance. To better understand the psychoanalytic method and theory outlined in the preceding sections, imagine a session unfolding. This is psychoanalytically oriented counseling applied to the case of Sen. In the case of Sen, the client is experiencing severe symptoms of depression, alcohol abuse, severe guilt, and suicidal ideation. Indeed, Sen says he has little to live for and feels responsible for ruining the lives of most everyone with whom he is close. He is in a jeopardy at his job after having been suspended for angry arguments. It seems clear that turmoil is reaching the boiling point and that to encourage him to explore unconscious conflicts and dynamics at this point is ill-timed. As in most any other approach, the first step in counseling with Sen would be problem solving in nature, including a possible psychiatric referral for medication to lessen the severity of his anger and depression. What would distinguish a psychoanalytic approach at this beginning phase of counseling? Not so much what could be directly observed in a session, but more what is in the mind of the psychoanalytically oriented counselor. That is, the hypothesis and questions generating in the therapist's mind about what is happening inside the client's mind. In engaging in such internal theorizing, the counselor can guide his or her interventions. For example, with Sen, there seems to be a great risk that he will leave counseling sessions abruptly. His solution attempt for his problems on the reservation was to leave. He seeks the immediate amelioration of depressed feelings with alcohol, and this speaks of his limited tolerance for frustration. Therapy is not likely to afford him the immediate gratification that alcohol would, and he will likely become easily disenchanted. Add to this that he feels non-native Americans are prejudiced against him, and assuming the therapist is not Native American, basic issues of trust are immediately present. the therapist might ask Sen if he feels he could work with a non-native American or if he would prefer to be referred to someone else. At this early stage and with this type of client, analyzing the client's feelings about prejudice is premature. The classically Freudian technique is one of such analyzing, but in this day and age, that would be a caricature more befitting a Bollywood movie. An analytic approach would recognize that the first and pressing need therapeutically is to build trust. Asking about Sen's desire regarding the ethnicity of the therapist is an intervention towards that goal. It recognizes Sen's belief and concern without interpreting it as some expression of neurotic conflict. Another strategy to develop trust would be to attempt to establish a working alliance. For example, could the therapist engage Sen as an ally in trying to figure out what he could do to minimize the tension on his job? If so, the therapist would ask many questions about the job and in particular Sen's thoughts and feelings about co-workers and his supervisor. At every opportunity, the therapist would make comments to indicate an empathic understanding of Sen's perspective, that is, to see it and feel it through his eyes. With a client as guarded, angry and depressed as Sen, such empathic attachment is the greatest challenge to the therapist. What makes this so challenging is that a client such as Sen elicits emotional reactions from others, including the therapist. Sen is likely to express anger early on to the therapist, perhaps by being 10 minutes late for the first session. Perhaps as a sign of his conflict around anger, he would have been apologetic. Also, he was also coerced into coming to the appointment, so perhaps he is even more guarded and resentful than he usually is. How do counselors develop skill in empathic attunement? One defining feature of therapists with psychoanalytic training is that they undergo analysis. They have been in Sen's position as a client. Such therapists have not only talked the talk, they've walked the walk. This helps immensely to know, not intellectually but at gut level, what it feels like to be vulnerable, to not know, to seek help from another, to admit failure, and so on. As counseling progresses with Sen, more defining features of a psychoanalytic position will emerge. Perhaps chief among these are transference-related comments. For example, if Sen came late to a session and apologized profusely, the therapist might say something like, "You know, I had the feeling that you were apologizing for more than just being late, that you seemed to feel very badly about it, more so than what one would expect for 10 minutes. Any thought about that?" As therapy progresses, more observations and interpretations about Sen's feelings towards the therapist, his transference reaction, will be commented on and explored. The purpose is to help Sen see and understand in the here and now relationship with the therapist how and why he relates to people the way he does. This opportunity seems crucial for a client like Sen, and as so much of his history and reported problems have to do with the fundamental breakdown in relating to other people. No psychoanalytic approach would be complete without a discussion about a client's dreams. Dreams and slips of the tongue in everyday speech were seen by Freud as windows into the unconscious. In psychoanalytic therapy, dreams are most important for what they communicate about a client's hidden or unconscious thoughts and feelings about the counselor. In time, the therapist becomes the object of the client's thoughts and feelings, and long-standing fears and hopes from important others, mainly parents, get transferred onto the therapist. A dream in the course of therapy can only be understood and be useful if one sees the context in which the dream originated. In other words, what was going on in the session or sessions prior to the dream. In the case of Sen, there is a recurring dream at the beginning of treatment, which would not involve the therapist. Nevertheless, this dream would be of interest because it is a recurring dream that might change over the course of treatment to reflect conflict that might arise, in particular conflicting feelings towards the therapist. The first reaction to sense this dream is that he is trapped and that there is movement. In a movie titled Speed, a bus was wired with a bomb, and if the speed of the bus dropped below 50 meters per hour, the bomb would go off. This speaks to the urgency Sen feels. Things are hurtling along and he is losing control. I would be concerned about suicide given that he already said he has got little to live for. Another striking feature of the dream is that the bus driver is a woman. A woman is in control of his fate. She laughs at him sadistically as he is impotent with his banging with the pipe on the steering wheel. At the end of the dream, it is just Sen and the laughing driver, but he feels alone. The usefulness of such a dream lies in what associations the client and the therapist make while talking about the dream. Such associations are a continuation of the dream and help to flush out some of its meanings. Of particular significance are meanings regarding the client's feelings and thoughts about the therapist. If this dream occurred months into treatment, it might be speculated that the laughing bus driver is the therapist, taking the client places he does not want to go, painful feelings and memories, and never stopping long enough so the client can get off. Now let us sum up. Probably Freud's most important contribution is the profound impact his thinking had on our understanding of human development. Most of us acknowledge the importance of childhood experiences, understand the major role that sexuality plays in development, recognize the powerful influence of parent figures in our lives, assume that dreams and slips are often meaningful, accept the existence of the unconscious, and acknowledge that internal conflicts commonly occur within our personalities. We also recognize the healing power of the therapeutic relationship, believe that talk therapy can be a powerful vehicle for promoting positive change, and are optimistic that treatment can help most people to lead more productive and rewarding lives. Whether or not we agree with the psychoanalytic model of treatment or with an emphasis on infantile sexuality, Freud's profound contributions to our understanding of psychological development and knowledge of psychotherapy and counseling are undeniable. Although few readers will go on to become psychoanalysts, all will find that their conceptions of mental health and mental illness and their approaches to treatment are colored by their knowledge of Freudian psychoanalysis.